Muscle relaxation forms an integral part of modern anesthesia. Relaxation can be induced using non-depolarizing neuromuscular blockers such as rocuronium. Rocuronium competes with acetylcholine and binds to acetylcholine receptors on the postsynaptic membrane at neuromuscular junctions. Various surgical procedures may benefit from a deeper neuromuscular block to provide optimal conditions. Deep blockade can further abolish neuromuscular protective reflexes such as coughing or gagging over moderate blockade. This can also improve conditions for intubation, helping to prevent laryngeal trauma. This can be advantageous during abdominal surgery because even the slightest muscle tone in the abdominal wall can decrease the surgeon's field of view. Therefore, complete muscular relaxation is important during laparoscopic procedures to maintain an adequate working space. This can also reduce insufflation pressures required during surgery. Deep blockade can also help wound closure due to the lack of tone within the muscles. Therefore, agents like rocuronium have been used throughout surgery to induce a deep block. Until recently, deep neuromuscular blockade has been a risk factor for the development of airway obstruction, hypoxia, pneumonia, and atelectasis. Acetylcholinesterase inhibitors have been used to reverse deep neuromuscular blockade. However, their onset is often slow due to competitor receptor binding, and side effects can include pneumonia, bradycardia, hypersalivation, nausea, and vomiting. It has been suggested that rapid, complete reversal of neuromuscular blockade could make it possible to use deep neuromuscular blockade during surgery to improve surgical conditions with reduced adverse side effects. Bridion Sugamidex rapidly reverses deep neuromuscular blockade induced by rocuronium. It is administered intravenously into the body. Once within a blood vessel, it encapsulates rocuronium to form a complex at a 1:1 ratio. It binds electrostatically to rocuronium and then traps it within its hydrophobic cavity. With a high association rate and a low dissociation rate, it forms a tight complex ratio. The removal of rocuronium from the blood creates a concentration gradient, causing the remaining rocuronium found within neuromuscular junctions to move into the plasma, where it can be sequestered by further Sugamidex molecules. Sugamidex is biologically inactive and does not bind to plasma proteins. Rocuronium is removed within a few minutes, allowing the neuromuscular junctions to recover their activity. The Sugamidex rocuronium complex is not metabolized by the liver. It is excreted from the body within the urine. Sugamidex rapidly reverses any depth of neuromuscular blockade induced by rocuronium. This allows surgeons to select the most appropriate depth of blockade to improve surgical conditions right up to the end of surgery.